Hello, everyone. So, today we are going to talk about specific learning difficulties and disability. A lot of times, parents reach out to us saying that my child is gradually declining in his academic performance and he really does not take any interest in reading and writing. So, those are the times when you start thinking whether your child has a specific learning difficulty or not. So it is basically ability of a student or a child to listen, think, speak, write, spell, or do any kind of a mathematical calculation. So when the child is struggling with reading, we call it dyslexia. When the child is struggling with writing, we can call it dysgraphia. And challenges with doing mathematical calculations are called as dyscalculia. And if you look at the magnitude of problem, 63% of the people would know somebody or the other with specific learning difficulties. And somewhere around 40 to 45% people wrongly think that children with learning disability have low IQ, which is not true. Specific learning difficulty is seen with a normal intellect. So, and then these children at time also face some challenges with the memory. They have difficulty in remembering the number facts or doing mathematical reasoning. Some motor incoordinations can also be observed. So I'll just briefly tell you the challenges that a child may face with when in reading. So they may have trouble learning sometimes the nursery rhymes. They may have trouble reading the letters, the sounds of the letters, or gauging the sound of a letter. Sometimes they would just take longer than usual to read a word. They may break the word into multiple parts and then speak it out. Even there could be mispronunciation of certain familiar words, like simple similar sounding words may be difficult for a child to read. There will be confusion between B and D while reading or while writing PQ. So they may write when it is a dysgraphia. So by writing, they may make mirror images, or they may start writing from the other end of the page, and make simple spelling mistakes, punctuation errors, may not be able to write straight on a straight line. So all these features, when we observe in the writings of a child, uh, or the handwriting is absolutely not clear. So all these features, when they're there, must raise an alarm for us. In dyscalculia, the child will not be able to write the numbers clearly, will make mirror images of the numbers, will not be able to do basic calculations, which other children of his age are able to do. Conceptually, will find it difficult to understand. So when all these challenges are there, do not take it as a as that the child is being stubborn or does not want to do work. Somewhere the child is not able to do it. So its diagnosis is done by a detailed psychoeducational evaluation, where we do an IQ test, we do a complete psychoeducational evaluation to find out what are the challenges the child is having with the help of a clinical psychologist, and then be able to plan a proper intervention for the child, along with the remediation if needed. So sometimes specific learning difficulties can have coexisting conditions like ADHD. So those need to be taken care of or managed simultaneously. So it needs a holistic care. It needs a proper assessment and evaluation. And if any of these features are there, if a child is uh, having poor academic performance, and they are not taking interest in reading, writing, get them evaluated with an expert to help them with remediation and help them achieve their goals, because these are the children who have normal IQs and they can really learn and do things. It's just that we need to teach them the way they are going to learn. And if you need any help or support or wish to inquire anything, please reach out to us at the following details. Phone numbers, emails are given in the video. Thank you so much.